From the News Channel 5 Network and AARP, this is AARP Connected.
It's a great day to be connected. Hi, I'm your host, Mia McNeil, and welcome to AARP Connected. I'm glad you've tuned in. We've got a great show in store for you. As you know, during each episode of AARP Connected, we explore important issues that empower you to choose how you live as you age. Today, we'll be talking about living healthy, and in just a few minutes, we'll be joined by Dr. Ralph Alvarado. He's not just any doctor, he's Tennessee's top doc, the Commissioner of the state's Department of Health. But before we get into that conversation, let's check out a segment we call Things You Need to Know.
Everything from what you eat to how often you text can affect the health of your joints. Here are 3 horrible habits for your joints you need to know about. If you're a smoker, stop now. Smoking does a number on your joints. The nicotine in cigarettes narrows blood vessels and restricts the amount of oxygen and nutrients that reach the joint cartilage. If you are sedentary, get moving. Frequent sitting leads to tightness in the hips and legs and weakness of core stabilizing muscles. Aim for 30 minutes of joint-friendly exercise 5 days a week, such as walking, water aerobics, and swimming. Stop texting and put your phone down. Constant typing on that mini keyboard creates inflammation of the joints in your hands and arms, which can lead to pain and stiffness. To avoid joint pain, take breaks and consider relying on the speech-to-text function on your smartphone. For more health tips, go to aarp.org/health.
Ads on Instagram, Facebook, and TikTok can be creative and enticing, but they can sometimes be deceptive. Here are 4 ways to shop wisely on social media to get your money's worth. Check to see if the company is legitimate. Look for a physical address and phone number. If there's no address on the company's website, think twice about buying anything. Read the fine print. Look for spelling errors and odd disclaimers. Also, make sure they allow at least 30 days to make a return. Do your research. Do a search with the name of the company and the words fraud, complaint, or scam after it. Use other consumers' experiences to guide yours. And pay with a credit card. You can dispute charges and potentially get your money back if the item never comes or you're not satisfied and the company doesn't help you resolve your issue. For more tips, go to aarp.org/fraudwatchnetwork.
And finally, frauds and scams are on the rise in Tennessee. The Federal Trade Commission just released its Consumer Sentinel report, and while Tennessee improved in the national ranking, losses from scams surpassed $157 million in 2024. But you can fight back against fraud. We've got lots of fraud fighting tips and resources at aarp.org/fraud, so you can learn how to stay one step ahead of the bad guys. And this may surprise you, young people were victimized by scammers more than older adults. So please share these tips and resources with a young person in your life. If you're feeling under the weather or blue, our next guest should perk you right up. We're talking about living healthy and staying well on the show today, and we've got the top public health official in Tennessee with us. Today we're joined by Dr. Ralph Alvarado, Commissioner of the Tennessee Department of Health. Dr. Alvarado has been a practicing physician for the past 29 years, and he has now served the last decade in public service. As a physician, Dr. Alvarado has worked in a variety of clinical settings, as a hospitalist, in primary care, and at skilled nursing facilities. And we are thrilled to have him connecting with us today, so let's jump right in. So Dr. Alvarado, tell me a little bit about what the top priorities are for health in Tennessee, how these priorities specifically address the needs of adults ages 50 and older, and what your department is doing to meet those needs.
Yeah, so thanks for having me on the show first and foremost, and thanks for all of you who are watching. So many things we've got to do. We're Tennessee, a state that's got a top 5 ranking in so many things when it comes to tax structure, when it comes to to economy, growth, but we're bottom 10 in so many things that are public health outcomes. And so we're constantly trying to work on those things as a department. And I've been talking to the legislature, talking to a lot of folks in the community about what we can do to help improve that. When we come out of a pandemic, a lot of folks, I think, were very, the department was kind of down, I think, downtrodden after a lot of work that was done. And so a lot of efforts were made in trying to see how can we build the trust back in the Department of Health. And I've told our department we're going to work on things that people expect for us to work on. And a lot of those things are things that are killing people in Tennessee, which are typically heart disease and cancers. So a lot of the focus that we've got are the things that are underlying those themes. So we're trying to work quite a bit on tobacco prevention, on vaping prevention for youth. There's a lot of products that are coming out that claim to be harm reduction, but in reality probably are just as harmful as combustible cigarettes, what we're finding out now. We're working on cancer and preventative screenings for folks. So a lot of people don't know when they're supposed to get their screenings performed. They're changing all the time. And our providers sometimes have a hard time keeping up with that information as well. We've gotten some funding in this upcoming budget to help address a lot of cancer screenings for lung cancer and for colorectal, which are the number 1 and 2 killers for us here in Tennessee. We're also working on trying to, again, accelerate action on promoting healthy aging and reducing a lot of risk factors for that. There's a lot of energy on blue zones. We're starting to see some of that. People, and we might have a chance to talk about that a little bit later as well, but people are looking at blue zones as an opportunity on how you can age better and have better quality and quantity of years. And so we're working on trying to accelerate programs that will help reduce a lot of risk factors for unhealthy aging for folks. Also trying to reduce, again, chronic diseases and be aware of those things and try to lead healthier lifestyles and that. And then also, like in any time that we've had, is always healthcare access and affordability. And so a lot of people, as they get older, might have a harder time finding a way to get health care. We're trying to make sure that people can get connected to a lot of those resources. So we're working very hard on trying to accommodate that. And we've, again, we're trying to put a lot more focus on people as they get older to make sure that when they age, that they know where they can go to for a lot of resources. Tennessee has established a lot of that in the state and just getting people connected.
That's fantastic. So we know that you are doing some amazing work to ensure that healthy aging components are part of your department's work. Can you talk to us a little bit more about that?
Sure, yeah. So, it's interesting how many states are not prepared for this. And when I first got into the role, my department asked me, hey, what are the things that you want to focus on? And I still practice in seeing folks in skilled nursing facilities. I see a lot of the frustrations that families experience, that a lot of patients experience, and not knowing where to go to or how to find specialists and find assistance in that. A lot of times providers are busy and people will ask a particular question. They may not be well versed in that. And so what I've envisioned is trying to create a Department of Health that can become an information center for people as they get older, so that you can rely on your local health department, that if you have a question that you can just go there as almost like an information center to ask about resources, how to get connected, insurance questions that you might have, where to get screenings done when it comes to things for dementia. And so as part of that evolution, we've created an Office of Healthy Aging within the department. It's a very small team, but mighty. Sally Pitt, Chelsea Ridley, Rochelle Roberts are all part of that, and they're working very, very hard on trying to make sure we have good connections and to have a seat at the table on national discussions that Tennessee now has as a creation of that office. So we've been working really hard on that. Also trying to create a lot of infrastructure within people that are getting older. As we get older, we rely more on our medical professionals to make sure we have specialists who can manage and handle a lot of those issues. I think we're concerned about the wait times that people have right now to get a dementia screening done or to get a formal evaluation done by a neurologist or by a psychiatrist. And so we're trying to work on setting up a memory care network is kind of our goal. We're hoping to, over time, convince the legislature and the governor's office to be able to consider funding some of these plans. We're working with our university partners on trying to get those things accomplished as well. And then again, for us, it's trying to work on an age-friendly ecosystem through it with AARP as partners. We've got all of our health departments that are also working on trying to create that. I think most of our health departments by later this year should have that designation is our hope. And then we're also striving towards making Tennessee an age-friendly state. We're working with our universities. MTSU recently came on board as an age-friendly university. ETSU is looking at that. And we're trying to talk to our chambers of commerce and other institutions, financial institutions, to become the same thing, to be age-friendly, so that when people think about, hey, where do I want to retire to? We've got a very, again, an attractive system when it comes to taxation, but we want to be able to have people come here and know that they've got the resources and the support to come here and retire.
I love what we're talking about right now. Let's take a short break, and when we come back, we'll talk about what you can do to level up your wellness game. So stick around. Well, okay, welcome back to AARP Connected. If you're just joining us, we're visiting with Tennessee's top health official, Dr. Ralph Alvarado. So, Commissioner, what can people do, what can our viewers do right now to begin that health journey that everyone wants to get so bad?
Yeah, no, sure. This is something we love to talk about in the Department of Health. So the big things are to focus on is the things that we've heard from our doctors our whole life is you want to have exercise, eating properly, obviously. Movement is really important, and then connectivity with others. I tell you, I still work in skilled nursing facilities, and I see people that are getting younger and younger coming into skilled nursing facilities. It used to be a place people would get into their 80s or 90s. Now we're getting 40, 50, and 60-year-olds, and a lot of it is just, frankly, it's just lifestyle choices. And so we try to encourage people to start moving, to move regularly. It doesn't have to be major workouts, but just something as simple as walking and getting up. And you can start at your own pace at first, but to do that on a regular and routine basis keeps a lot of your joints mobilized. Eating things properly. I mean, yes, we all want to cheat on our diets, but making that an occasional occurrence, not a routine occurrence. And eating things that are well balanced in your diet. Make sure you get good servings of fruits, vegetables. Plenty of water is also very, very important. And then the other thing that's really important that we've noticed that really helps with longevity and help, a healthier lifestyle is connection to others. We've come out of a pandemic where people are more isolated, and as we get older, we naturally isolate ourselves as well. We spend a lot of times on our cell phones instead of talking to other people. Get reconnected. Join a church, join a social club, something locally to connect with other people, and that helps you live a healthier lifestyle. You kind of watch out for each other, and we've seen that kind of improves things all along.
So we know that an increasing number of Tennesseans are now living with Alzheimer's disease. Mm-hmm. So why is it so important for your department to lead the effort in combating this disease?
Sure. I mean, any kind of disease typically falls within the Department of Health. We're here to help prevent diseases. We also work a lot on trying to identify things that are killing people in Tennessee, and so it's become a top 10 killer now. Dementia is, I think, number 7 overall on our causes of death, and I think for women, I think it's gotten as high as 4th. So we're very interested in trying to prevent those things, and so that's the work that we often will do. Is that it's a chronic disease. We try to implement a lot of population-wide policies that'll help reduce risks and try to identify those things. There's a lot of focus on what tobacco does for folks with dementia. Obviously, alcohol consumption, other kinds of substances that people may have used in the past. Those exposures can cause higher risks of dementia. And then again, processed foods, things that are high in sugars. There's a topic now that's being discussed about type 3 diabetes, almost being looked at as causing a lot of changes in the brain that can cause people to have dementia at earlier stages. So we're trying to identify those. A lot of studies being done, a lot of research being done. And as we identify those, we'll make the public aware. But just to lead, again, healthy lifestyles is important, connection with others, problem solving, all those things will improve people's abilities to reduce the chances of getting dementia. But it is starting to creep up on the list of things that's killing people in Tennessee.
Yeah. So obesity and heart disease. Mm-hmm. What are some things, some choices that people can make at the dinner table to prevent that from happening?
Sure, yeah. So, anytime with extra weight, some of us will probably have a higher predisposition to have extra weight. I mean, we always hear people talk about how this person could eat anything and they never gain an ounce, and then others just look at food and gain weight. But if you have that predisposition in your family, you have to be more conscious of it at an earlier stage. And so it's important as far as timing. I think most people, the habits we get into is if we get comfortable, we resort to comfort foods, snack late at night, we're watching TV when we're inactive, and those are just added calories. I always recommend to people if they can limit their time frame, they say, I'm not going to eat before this time in the morning and not after a certain time in the evening. To limit that time frame really, really helps out. Also, again, eating foods that are going to be lower in calorie. You don't want things that are processed with high sugars, high fat foods, anything that's processed. If you can prepare your own food from scratch, you know what you're putting in there. And then portion size. If you tend to like a lot, I mean, whereas Americans, we like to eat large portions, limit your plate size, smaller amounts, drink plenty of water. The more water you drink, you'll find that your hunger and desire for food goes down as well.
You're telling me to limit those value meals. I got it. Okay, I'm really enjoying our discussion and I'm feeling healthier already. We need to take a short break, and when we return, Dr. Alvarado has more to share about how you can be your healthiest self. Come on back. Welcome back to AARP Connected. We have a few minutes left with our guest, Dr. Ralph Alvarado, Commissioner for the Tennessee Department of Health. So, We talked a little bit about Alzheimer's before we went to break, and I know that you all have been doing some real work about the memory care assessment as it relates to dementias and such. Can you talk a little bit more about that?
Sure, yeah. So, as a provider, I would see a lot of patients who would come into my outpatient office and would have concerns. Family would say, hey, look, mom or dad or a spouse might be having some trouble with their memory, and you would do a screening examination in the office, and that would be a borderline result, and you thought, well, they might have it, they might not. I'd like them to see a specialist. And so when you try to refer somebody to a specialist, it might be a 10, 12-month, 14-month wait here in Tennessee or in other states. And so the problem is we don't have enough specialists around. So how can we get people in to get a specialized evaluation sooner? Other states like Georgia have developed a system called a Memory Care Assessment Network, in which they have a hub and spoke model where they're maybe tied into our universities in closer regional areas, but would have a clinic where a specialist could be there and could do an evaluation much sooner. So you're not waiting 12 months, having to find a ride to drive all the way to Nashville or Chattanooga or to Knoxville or to Memphis, and you could go right away to somebody closer to home where you can get that evaluation done. It's going to take a bit of investment from the state. We're hoping to have that done. Our university partners, I think, are like the idea and the concept, but we can get people in quicker. We're also hoping to have navigators, and those are people that can actually, as you come in to get that evaluation, you might need some kind of help or assistance in terms of respite care for a provider or other resources when it comes to insurance, transportation, food, housing, different things, that we can connect that individual to the different departments in state government to help get them the help that they need. And so we're hoping to create that system. It's going to take a bit of an investment, and so we're appealing to the governor, the legislature in the future to see if we can get those systems done. I think it'll work well with our universities.
That's going to be so helpful for so many people. So looking toward the future, what do you see are the biggest public health challenges that are going to be facing Tennessee?
Yeah, the whole state, obviously, we've talked about a few of those. So a lot of things like we mentioned tobacco, heart disease, cancers, screenings, getting those things done. The sooner we can get someone in for those evaluations, the better. I remind somebody, a stage 1 cancer, your chances of survival are so much higher. The cost is so much less than if you find out when you're stage 4 and you're actually having symptoms. So getting people with that mentality of getting those evaluations done. But really for our aging population, there are so many people getting older, which is a great problem to have, but we often don't have the resources or the providers available for that. So it's trying to develop that network of providers to make sure we have those folks out there and getting people tied into resources. So many people that have come to a doctor and say, where can I go, or to a hospital, and they don't know where to refer them to. And again, we're trying to invite people to let them know that our health departments are going to become that location where if you have a question, you can call, you can visit, and get you connected to all the things that are available for you out there. And so we're working really hard at that. But I think that's the biggest thing, is there's so much volume of people that are coming through right now. And as a state, most states are not ready. We're trying to take a focus for that here in Tennessee to make sure that we're prepared, and we're going to take care of people who are going to choose to call Tennessee that place home where they want to come and retire and spend their last years.
Fantastic. Where can folks find out more information about what you've shared today and to just get in contact with the department?
Sure. You can always look up phone numbers for the department, but our website is www.tn.gov/health. If you go to that, you'll be able to find all kinds of information of everything we do in the Department of Health. We do so much. People often don't know all the breadth of resources that we have, and the people that are very committed to helping people in their communities. There is a section there of Office of Healthy Aging. You can also look up information there that's specific, emails for people in our staff that you can email. So please look us up, research all that information. At the very least, if you're not real big on the computer or on your phone, just either drive to the local health department or give us a call by phone, and we should be able to get you connected to all those resources as well.
Fantastic. Well, I'm feeling better already.
There you go.
It has been wonderful having you on the show, and I hope our viewers are thinking about how they can become healthier in their lives. So thank you again so much for what you're doing.
My pleasure. Thank you.
If you'd like to connect with AARP, we've got some fun community events coming up. We're hosting fraud fighting events, music lessons, and pickleball clinics in communities across the state. It's all free, and no AARP membership is required. Find out more at aarp.org/TN. Stay in the know on all the latest AARP is doing in Tennessee. Connect with us on any of these popular social media sites. And if you enjoy podcasts, we will have a podcast version of each episode available wherever you download your favorite podcast content. Just hit subscribe and get notifications when new episodes are available. Well, that's all the time we have today. I'm Mia McNeil. I hope you found this valuable and informative. Thanks for being connected.